Hello friends. Today we are going to discuss about mental illness and health insurance. I am Dr. Suresh, Bada, Professor of Psychiatry, working at NIMANS, Bangalore. In this video, I am going to discuss about mental illness and health insurance. What is the present legal status? What are the different case laws with regard to mental illness and health insurance? What are the precautions you should take before you buy any health insurance from mental illness perspective? Let's understand what is health insurance. Health insurance can be defined as an insurance for future medical or surgical expenditure. Here, medical illness, also considered as, includes mental illness. Let's understand in simple terms. It is a contract where an individual or a group of people purchase in advance the health coverage by paying a premium. The collective premium is considered as a corpus. This corpus will be utilized if a member falls sick or paying the bills of the hospital. But unfortunately, mental illness was never considered for health insurance, which was kept as a exclusionary criteria. That means if a person with mental illness has a mental illness and if he claims for health insurance, it was considered as not claimable. This was a complete discriminatory practice. But this changed. After the implementation of Mental Health Care Act of 2017, there has been a paradigm shift with regard to mental illness and health insurance. Let's discuss this. This happened because of United Nations Convention on Right to Persons with Disability 2006. India signed this United Nations Convention Right to Persons with Disability on 1st of October 2007. Once we had signed, we need to align our local laws. The earlier Mental Health Act of 1987 or Disability Act of 1995 were not in sync with UNCRPD. Hence, the new laws were amended and new laws were brought in. Those laws are Right to Persons with Disability Act of 2016 and Mental Health Care Act of 2017. Let's discuss them briefly. If you look at the Article 25 of UNCRPD, it talks about insurance. Not only health insurance, it talks about general insurance. What does it say? It says under Article 25, state parties shall prohibit discrimination against persons with disability in provision of health insurance and life insurance where such insurance is permitted by national law, which shall be provided in fair and reasonable manner. That means not only health insurance, life insurance should be in parity for all persons with disability. Along with this, Mental Health Care Act of 2017 came and that brought in a paradigm shift. In this Mental Health Care Act of 2017, Section 21, subsection 4 talks about right to equality and non-discrimination. In this subclause, it clearly says every insurer, that means insurance company, shall make provision for medical insurance for treatment of mental illness on the same basis as it is available for treatment of physical illness. That means if you are providing medical insurance for physical illness, that means mental illness should be covered. That was clearly said under Section 21, subsection 4. So, Mental Health Care Act of 2017 came into force on 29th May 2018. That means already 4 years have passed from today. And even Insurance Regulatory Development Authority of India also gave a notification on 16th August 2018 telling that all insurance companies are hereby directed to comply with the Mental Health Care Act of 2017. That means all insurance companies, both general insurance and also medical insurance, should cover persons with mental illness. They cannot be excluded. But unfortunately, the non-compliance was a norm. That means many insurance companies did not accept person with mental illness, and mental illness should be included in health insurance was completely denied. In spite of the law, there was many health insurance companies refused to cover mental illness. This was highlighted in many newspaper articles. Questions were raised in Lok Sabha and few cases reached court. Let's discuss each one of this. Very important was a question raised by a member of parliament, Shri Santokh Singh Chaudhary from Jalandhar, on 15 July 2019 with regard to discriminatory practices of health insurance. These questions were raised in Lok Sabha. This is the cutting of the Lok Sabha questions which were raised. And the questions were answered by none other than the finance minister. Let's look into each one of these questions. The first question was, is it the fact that insurance for mental health has been launched by insurance companies in India? If it is so, please provide the details. Whether the government has laid down any guidelines in this regard. The number of persons who have availed mental health insurance, provide the details. And the fourth, the steps taken by the government to increase the coverage of mental illness under the insurance. So these four important questions were raised. The Finance Minister, Honorable Srimati Nirmala Sitharaman, answered this question. She responded to all four questions, telling that IRDAI, that is, Insurance Regulatory Development Authority of India, has issued a circular on 16th August 2018 and also letter dated 22nd October 2018 directing all insurance companies with the said provisions need to be complied with Mental Health Care Act of 2017. So it was clearly a notification has been given, was responded in the Lok Sabha. Further, the finance minister also responded saying that IRDAI has also advised insurance to ensure the person affected with mental illness are given similar treatment as person affected with physical illness. That means there should not be any discrimination. Further, insurance companies must disseminate the underwriting policy put in place in this regard, and communication should be sent out to all the officials across their offices, branch offices, salesperson, so that there is no discrimination against persons with mental illness or a person who is suffering from mental illness. So the insurance should not be denied. Further, the finance minister also responded saying that IRDAI has informed that 110 products covering mental illness have been approved by it subsequent to the issue of circular dated 16th August 2018. But however, they also reported they do not have how many people have availed this insurance benefit by state-wise or by UT. They did not have information. But however, this was a landmark milestone in the history of India with regard to mental illness. That means even in the parliament, the issue has been raised. Further, 2nd June 2020, Insurance Regulatory and Development Authority of India also gave a notification. The notification clearly says that persons with disability, persons with HIV/AIDS, persons with mental illness should not be discriminated. Both life insurance, general insurance, and health insurance need to be covered. This is the notification. These discrimination were seen in private sector. What about the public sector? With regard to public sector, one of the biggest health insurance scheme across the world is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, that is ABPMJ. This was introduced. This coverage, especially this Pradhan Mantri Jan Arogya scheme, offers free health insurance coverage up to 5 lakh rupees to families and backward class people. That means the people who are from the backward class can take or avail health insurance per year 5 lakh rupees. And this is to cover approximately 10 crore population. That means, imagine in 138 crore population, 10 crore are getting 5 lakh rupees per year health coverage. Not only that, this scheme is for cashless hospitalization and treatment covering both secondary and tertiary care. This was an important landmark. ABPMJ was introduced. Further, depending upon the income slab, PMJ offers co-payment method for another 53 crore people across India. This co-payment includes such as, for a certain income slab, 30-70. That means 30% will be paid by the public or the citizen, 70% will be paid by the government. So further, it may be also depending upon the income, it may be 60-40, 50-50. So these kinds of health insurance were introduced under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Not only that, this covered 53 crore population, and many states were given complete independence with regard to federal structure. Keeping the federal structure here, the central has introduced this ABPMJY that can be adopted by the state government. Again, the co-payment method was introduced. And this is one of the largest public sector health insurance across the world. Let's look into the health benefit package. The package was introduced in 2017, version 1, version 2. At present, 2.2 is the version. Let's look into the mental illness package. This is the mental illness package. If you look at the package, there are 10 different illnesses have been covered. Earlier it was 17. But in the version 2 and in version 2.2, only 10 of them have been covered. Let's look into each one of them. The first column is package code. Second one is illness covered. Third one is procedure code. Fourth one is procedure name, and the amount per day has been also been clearly said there. First one is mental retardation. If you look at mental illness definition as per the Mental Health Care Act of 2017, mental retardation has been excluded. But however, in Ayushman Bharat PMJ, it clearly mental retardation has been included. So 1,500 rupees per day treatment with regard to has been given. Further, organic mental disorders. It may be dementia, it may be Parkinsonism, related mental illnesses, and other organic conditions like head injury and mental illness are covered here. Further, schizophrenia and schizotypal delusional disorder. So, MM003 is the code here. 1,500 per day has been given. Further, neurotic and stress-related disorder, mood and affective disorder, behavioral syndrome associated with physiological disturbance and physical factors have been covered. Further, substance abuse has been considered here. This is for general ward. Not only that, there has been a clear amount 10,000 has been given for pre-ECT checkup, which includes CT scan, blood test, electrolytes, hemogram, vitamin B12, vitamin D3, ECG, various other approximately 10,000 has been given for pre-anesthetic checkup and also for ECT. Again, ECT per session is 3,000 rupees have been given, and for RTMS 1,000 rupees. As I mentioned, this is for general ward. But however, for a person who requires ICU, which is considered as high monitoring unit, where 3,000 rupees has been increased. That means for general ward is separate, for high intensity monitoring units, they have been changed. That means it is 3,000 rupees. So this coverage has been given for persons with mental illness under public sector. But however, one need to remember this. This is only for, at present, for public sector. That means Ayushman Bharat is not applicable for mental illness for private sector. That means private mental health establishment. However, over a period of time, depending upon the utilization, this will be extended for private sector also. Let's look into the private sector health insurance, what is happening. In spite of this legislation and notification from IRDAI, many private insurance companies denied the rights of persons with mental illness. That many various reasons have been quoted for this. Many of the insurance companies were not aware of the new legislation. Insurance companies, for their gain, refused to give the benefit. Further, many of the companies said under the current premium, they are not eligible. In the next premium, they will be given. So these kinds of excuses were given. Further, stigma, discrimination for persons with mental illness was striking, and many of the insurance companies clearly said that they were not aware of the risk assessment. That means what should be the premium if we include schizophrenia, if we include bipolar affective disorder, acute psychosis, if we include substance abuse. So that risk assessment for premium data was not available. This was one of the excuses given. And further, many persons with mental illness, because of their absent insight, never availed this health insurance benefit. Even if they are aware, they were worried about stigma and discrimination. Hence, the persons with mental illness health insurance was completely denied. Hence, many of these cases reached High Court and Supreme Court. Let's discuss some of those cases. First and the foremost, Gaurav Kumar Bansal versus Union of India. A PIL was given to the Supreme Court. This public interest litigation filed by the advocate Gaurav Kumar Bansal clearly mentioned about the violation of the provision of Act 2017. It clearly said that many insurance companies refuse to give mental health insurance coverage. Although IRDAI has instructed for the same, these private insurance companies refuse to give. This PIL is continuously running now, and the Supreme Court is monitoring for the provision of this Mental Health Care Act of 2017. So apart from this, there is another very important case law has come. One of a person who was suffering from mental illness had approached the High Court of Delhi. In this case, the petitioner obtained health insurance policy from National Insurance Company in 2016. He was paying his premium, but unfortunately he developed schizoaffective disorder. Even he had paid the last premium in 29th May 2020. And in June 2020, the petitioner developed schizoaffective disorder. This was an unfortunate. He was hospitalized for 1 month and required various treatment in the hospital. Imagine this was during COVID. And the hospital bill came approximately up to 5.5 lakh. Since the petitioner was diagnosed with schizoaffective disorder, the insurance company refused to pay the health insurance. So petitioner applied for reimbursement. The health insurance refused. National Insurance Company Limited rejected the claim, telling that mental illness is an exclusionary clause. That means it is not included. Hence, the petitioner approached Ombudsman. Even the Ombudsman supported the health insurance company and refused to give the claim. Hence, finally, the petitioner reached the High Court. The High Court gave a landmark judgment. This was the Delhi High Court. The Delhi High Court clearly said that the Mental Health Care Act of 2017 and the provision thereof are absolutely relevant for a person who is suffering from mental illness, that is schizoaffective disorder. Thus, the petitioner was entitled for reimbursement of her claim as per the provision of Mental Health Care Act of 2017. Hence, the insurance company was forced to pay the health insurance. That means, my dear friends, now no insurance companies can refuse it because there is a Mental Health Care Act of 2017. Further, Insurance Regulatory Development Authority of India is monitoring it, and further Supreme Court is also monitoring. Again, there was another case. This is from Maharashtra. Again, a person who was suffering from mental illness has applied for health insurance. Let's look into this case law. The petitioner approached the court on rejection of petitioner's policy proposal of health insurance. The proposal was rejected because the petitioner was suffering from bipolar affective disorder type 2. That means the health insurance said, we are not going to give you health insurance coverage because you are suffering from mental illness. The petitioner's healthcare policy originally was from under one health insurance company, so he wanted to change over to another company. That is, portability was also applied. The petitioner 3, that means a person, the insurance company which is supposed to take the person refused, telling that since he is suffering from mental illness, we will not give you health insurance. This was the response given by the health insurance company. What did the High Court of Bombay say? The court said that the petitioner shall be entitled to get the health insurance coverage from the earlier health insurance company until we decide. Hence, there was a stay was granted for the rejection by the health insurance company. Again, this is another important case law where High Court has took the cognizance of the insurance companies refusing to pay health insurance coverage for mental illness. Let's look into the certain scientific studies now. If you look at the scientific studies from Western country, whether covering mental illness, does it reduces the treatment gap? The treatment gap is the number of people who are diagnosed with mental illness who are not on treatment. As per the National Mental Health Survey, around 70 to 80% of persons with mental illness are not on treatment. By introducing the insurance scheme, that is health insurance for persons with mental illness, will it improve? That was the question asked in one of the important study, but this is a study from Western country. In this, a systematic review of health insurance for mental illness and the treatment gap and health utilization was considered. And this, a systematic review study from the Western country clearly said, given the complexity of mental health service utilization of this diverse context, it was difficult to draw overall judgment on whether the impact of insurance enrollment was positive or negative for mental health care outcomes. That means, even in Western country where mental illness is included under the health insurance, they were unable to come to a conclusion by including mental illness under health insurance, whether the treatment gap will reduce, whether the treatment utilization will reduce, was not able to analyze. Further, another systematic review of mental health insurance from Australian National Disability Insurance Scheme was studied. Here, there were many studies were considered and the review of those studies was done. This is again a systematic review. Again, it said that the literature reporting on experience and outcome of schemes of people living with psychosocial disability are very, very less. Hence, analysis could not be done. That means because of the limited peer review literature with regard to mental illness and health insurance, that means again, there is no research available. But however, there was one more study. It also talked about the study clearly talked about the objectives to determine the impact on cost of insurance plan resulting by including mental illness and substance abuse. In this study, a systematic review was done where 12 studies were included. Those studies in which mental illness and substance use was considered for the health insurance. When they did the analysis, the author concluded by telling that by including mental illness and substance use, that did not increase the cost of the premium. That is, insurance plan's cost was not included. That means by offering mental illness and substance abuse under your health insurance, the premium will not increase. This is a study again done in Western country. And with regard to substance use, there are many studies which talked about by including substance use in health insurance, whether it is beneficial for the people or is it beneficial for the company or it is a risk for the insurance company. However, some studies have advocated that drug dependence treatment with terms and conditions have been accepted. Considering alcohol, nicotine, benzodiazepine dependence have been offered under the health insurance. But however, illegal substances are not covered because of the prevailing laws. That is, if you consider in India, NDPS Act of 1985, that is Narcotropic and Psychotropic Substance Prevention Act of 1985, clearly prevents and also punishes the person who is using those substances. Hence, the health insurance companies refuse to accept substance use for providing health insurance. Further, there are many insurance companies are capping on the number of days of inpatient care. This is especially in European countries. But however, we do not have any data with regard to Indian literature. Further, what are the challenges with regard to health insurance companies providing coverage for mental illness? First and the foremost is stigma, discrimination, and insight. A person with poor insight will not take health insurance. Further, even if it is the healthcare has been offered, he will refuse to take because he feels he is not suffering from mental illness. Further, relatively low consumer demand for psychiatric care. The simple reason is, again, stigma and discrimination. If I say I have mental illness, I need health insurance, then I have to go and talk to the customers or the executives of the insurance company. What will they think? What will be the public will think? And if I am raising complaint, they may say, you are a person with mental illness. Hence, lack of knowledge about psychiatric illness and treatment, lack of knowledge of awareness of their right. At the same time, insurance companies refusing and humiliating a person with mental illness is well known. Assumption that More liberal psychiatric benefits results in unnecessary and excess use is the thinking of the insurance company. Many of the insurance companies said that if we include these mental illness and substance use, our premium will rise very high. When we challenge this, they said that unfortunately we do not have data from Indian studies. Hence, this become a big roadblock for persons with mental illness with regard to health insurance. Let's look into the challenges in mental health insurance. First and the foremost, mental illness is a chronic illness like diabetes and hypertension. Hence, they will increase the premium. Further, at present, we do not know the data, how much the premium should be increased. Mental illness has stigma and discrimination. A person with mental illness, he himself has guilty that he is suffering from mental illness, and he is worried about the stigma and discrimination by the community and the health insurance company. Hence, it is considered as intangible illness. Physical illness can be seen, whereas mental illness can't be seen. Hence, the healthcare provider, the community, and insurance company refuse to pay a person with mental illness about their health insurance, telling that he is malingering. Further, some of the conditions have posed challenge for insurance companies, such as attempted suicide, deliberate self-harm, substance abuse, substance dependence, whether they should be given health insurance coverage or not. Further, a poor compliance of medication. We have seen many persons with mental illness do not take medicines and they have a frequent relapse. In such a scenario, if a person is stopping medicine by himself and he is going to get admitted in the hospital multiple times, what will be the risk? What will be the insurance premium? We do not have the data. Hence, risk-based calculation for premium in mental illness is difficult simply because of non-availability of data. Further, some of the conditions such as dementia, personality disorder like antisocial personality disorder, borderline personality disorder, autism, neurodevelopmental disorder like SLD, that is selective learning deficits, ODD, opposition defiant disorder, ADHD, attention deficit hyperactivity disorder, conduct disorder. How should be the premium to be fixed here? And how the reimbursement should be given? And most of this treatment invariably will be on OPD basis because they are lifelong illnesses. That means once the person gets this illness, it is difficult to treat. How should the insurance company should plan their premium? Further, rehabilitation of a person with mental illness, whether the insurance should be covered. Halfway home and long stay home, whether the health insurance should be covered or not. Psychotherapy on outpatient basis should be allowed or not. Family therapy, expressed emotion intervention should be covered under health insurance or not. Because again, they are all for maybe 1 to 2 years therapy on outpatient basis therapy. Sometimes social skills training and cognitive rehabilitation, whether the health insurance should cover them or not. Especially for the private insurance, these are the big challenges. The challenges not only posed by this illness, at the same time, non-availability of the data with regard to premium. Along with this, Mental Health Care Act of 2017, although it talks about the mandatory inclusion of persons with mental illness for health insurance, but it comes with own challenges. With regard to advance directives written by a patient, will challenge or pose a challenge for insurance company. As per the clinical practice guideline, if a person is suffering from mental illness, for example, schizophrenia, the first line of treatment may be risperidone, but the patient would have written an advance directive that he should be given aripiprazole or else maybe electroconvulsive therapy, and he should be treated by a hospital which is not empaneled in the health insurance. What will happen? This advance directive may challenge in the long run. Similarly, right to confidentiality, that is section 23, which will raise many questions with regard to divulging information to the health insurance company. How much should we disclose? How much we should write with regard to mental illness to the health insurance company? Unfortunately, Section 23 of the Mental Health Care Act 2017 does not discuss about this. However, we need to seek consent from persons with mental illness when we divulge information. Further, many insurance companies will ask complete Xerox copy of the file. And in such a scenario, we have to provide all sensitive data to the health insurance company. This need to be explained to persons with mental illness who is applying for health insurance. These are questions which have been raised in Western countries, but at this point of time, it's not raised in India. But the day may come where a person with mental illness will object for providing complete data or irrelevant data to a insurance company. Let's look into what are the important point for health insurance claim. Suppose a person with mental illness claims for health insurance or he files for health insurance. What he should remember? First and the foremost, most of the health insurance company will require admission. The admission to a mental health establishment advised by registered medical practitioner or a psychiatrist. Further, RMP, that is the psychiatrist or the doctor, should follow the clinical practice guideline or standard operating procedures. That means whatever the clinical practice guideline should be followed. If there is no active management, the insurance companies will be rejected. That means if a person is apprehensive that he may develop a mental illness or he is going to have a relapse, just admission and monitoring will not be covered under health insurance. That means active management should be there. Proper documentation is essential for claim to be honored. That we should remember. And also persons with mental illness for applying for health insurance should remember this. And coming to the last part of the presentation, please be aware and check for these important points when you are asking for health insurance. From the perspective of mental illness, check whether there is a capping for mental illness in your policy. You would have taken 20 lakhs as the amount covered. Unfortunately, some of the companies are applying cap for mental illness, telling that only 10% of the total sum insured will be covered for mental illness. That means you have to be aware and refuse those claims. That means it should be in parity with the physical illness. Further, look for any reservation placed for deliberate self-harm, suicidal attempts, and substance use or dependence. If they have been excluded, try to refuse those insurance. Check whether the OPD basis treatment is allowed or not, whether OPD consultation, OPD medications are reimbursed or not, what is the premium for it. Further, OPD basis daycare procedures like electroconvulsive therapy or RTMS, whether those procedures are allowed or not on OPD basis. Those need to be checked. Further, consultation and OPD based medications reimbursement is allowed or not, OPD basis psychotherapy, OPD basis family therapy and parenting training, especially for child and adolescent psychiatry, SLD remedial measures, assessment and therapy, whether it is considered or not, all those need to be checked. Further, check whether the health insurance company will provide for rehabilitation, whether it is halfway home, long stay home, daycare center, occasional rehabilitation, social skills training, cognitive retraining, whether they are covered or not. If there are capping, what is the capping? How many days? What is the amount it is capped? Any terms and conditions are placed need to be known. Further, you need to remember this. Hospitalization of a patient only for diagnostic and monitoring procedure is not allowed under health insurance. This is across medical illness and also mental illness. So, you will not get any health insurance benefit if you are getting admitted just for diagnostic procedures, because health insurance is only for active treatment and management. Every health insurance policy has a waiting period for pre-existing diseases. Imagine a person with schizophrenia wants to apply for health insurance. For 2 to 4 years, sometimes there is a waiting period. Check for those waiting period. How long is the waiting period? Why they have given so much of long duration need to be checked. And suppose if you have upgraded your policy from maybe 5 lakhs to 10 lakh, during this waiting period, that amount will not be covered. You have to remember this. And also look for the exclusionary clause. Is there specified disease, procedure, waiting period they are not allowed? So that is covered under the code XL02. Further, many health insurance companies comes with their room rent capping, that is limit. For example, if you have asked for 5 lakh rupees as the health insurance coverage, then it is 1% of the 5 lakh will be considered for room rent. That means it is 5,000 rupees. Many a time it may be 0.5%. You would have not read that. Check for those. Check in the face or the page 1 of your policy document where your family members' details are mentioned. Check for what is the room rent limit per day, because you would have taken, but they would have kept this exclusion or they would have kept the cap. Check for the capping of number of days for inpatient care. Many a time persons with mental illness require long duration of stay, maybe 1 to 2 months. If the insurance company has placed only for 30 days, that means the reimbursement will be given for 30 days. Remaining you have to pay from your pocket. Hence, look for those capping. When you buy a policy, the insurance company agrees us to take risk for your future expenses. They undertake the risk based on the information you provide while purchasing the policy. Hence, do not hide, do not give misrepresentation, do not tell lie when you are providing information. There should be complete disclosure so that the insurance company knows the risk. If you give a false information, the insurance company will reject your claim. When you buy a policy, check for the exclusion list. What are the illness covered under the policy? And you ask for clarification or any doubts. Do not buy health insurance based on the agent's report. Ask questions. Read the complete policy document. Then only you will know what is covered, what is not covered. Let's look into the document of checklist required for a claim. Recently you are hospitalized and you are now claiming for health reimbursement, that is reimbursement from the insurance company. What are the important documents you should have? First and the foremost is claim form, psychiatrist advice for admission under section 86 or 89, prescription, hospital discharge certificate, final hospital bill, medicines bills with prescription, final payment receipt for the hospital you are paid, and cancelled check for the insurance company for the bank account where you want to have the insurance. So these important documents should be there. If one is missing, the insurance company will reject. Don't give any opportunity for the health insurance company to reject your claim. Please follow these important documentation. Suppose, in spite of all these documents, if the insurance company rejects your claim, there is somebody called as Insurance Ombudsman. Let's look into this. The scheme of Insurance Ombudsman for a quick disposal of grievance of the insured customers to mitigate their problem involved in redressal of grievance or out-of-court settlement. This has been introduced by the Government of India. Government of India, in the exercise of powers conferred under the section 114 subsection 1 of the Insurance Act, framed for the redressal of public grievance rules 1998, which came into effect from November 1998, which clearly talked about the Ombudsman. Here, this Ombudsman will take the case and will solve the case out of court without going into adversarial position, so that the customer is not asked to run to the court. Those complaints should be filed within 1 year of the claim, and the claim should not be running in the court, either in the consumer court or in the civil court. Hence, in such a scenario, the Ombudsman will consider. First, before you give a complaint to the Ombudsman, you need to approach the insurance company and place your representation for your claim. And if the insurance company refuses your claim, or else if it gives a less amount of money, or by chance if they don't respond to you for more than 30 days, or else you're not happy the way the insurance company has dealt, in such a scenario, you can appeal to the Ombudsman by giving a written complaint against the insurance company and all documents which you had communicated with the insurance company. In such a scenario, Ombudsman will give the verdict and invariably it will be in favor of the consumers. But however, you have to be very clear. Your documentation should be proper. You should know what is Mental Health Care Act of 2017, what is IRDAI has given notification should be in your handy. To conclude, my dear friends, now mental illness are eligible for health insurance. Policy or reimbursement cannot be rejected because a person is suffering from mental illness. Please know about your rights. At the same time, health insurance exclusion policy, if it is there, please give a complaint to IRDAI. Know the waiting period for pre-existing mental illness. Please read the policy document properly. Ask for explanation. Ask for if there is any refusal of any claim is there. At the same time, approach the insurance company directly if they have refused your claim or they have given the less amount. Keep your documentation properly. Next, move. If you are not happy with the response of from your insurance company, talk to the Ombudsman and file a complaint there. And even if you are not happy with the Ombudsman, consider going to the court. Invariably, it will be consumer court. So these are the rights which have been given under the Mental Health Care Act of 2017 for persons with mental illness. So my dear friends, please remember this and educate your patients, persons with mental illness, about the health insurance coverage for mental illness. Thank you very much for giving your valuable time. Stay safe.